It's not as deep as what some of us are writing. Okay. So now let's look at our topic. We've all been in a good trial. Knowledge and perception and attitude towards blood donation among undergraduates of Obafemi Awolowo University Ile-Ife, undergraduates of OAU Ile-Ife. I don't know why I'm writing Obafemi Awolowo University info. So now knowledge, perception, and attitudes towards breaking it down using people. We already know our population, undergraduates of OAU. Now, our intervention is going to be adequate knowledge and positive perception of blood donation. It's going to be adequate knowledge and positive perception. And the comparison will be what then? Somebody should open on their mute their mic and say it.
Inadequate
Knowledge and negative perception of blood donation. And then what will the outcome be? Attitude towards blood. That will now be the attitude towards blood donation. The intervention or the exposure is adequate knowledge and positive perception. Adequate knowledge and positive perception of blood donation. The comparison is inadequate knowledge and negative perception. And what impact does it have? It's those knowledge and their perception of those things will now affect their attitude towards blood donation, whether they will donate blood or not. Do we get it? Tito, we were 88 on the call when the call went off. Do we get it now? Do we get it now?
Please, can you come again?
Can I come again? Should I come again?
Yes, please.
Somebody like for last year, the last one I did not put there is going to be their attitude towards blood donation. Now, the kidney is the population is undergraduates of OAU. The intervention or exposure is their adequate, maybe they have adequate knowledge and positive perception towards blood donation. They have positive perception towards blood donation. That's their I intervention. Then the comparison will be what? Poor knowledge and negative perception towards blood donation. The outcome will now be the impact. The impact of the knowledge and perception will have an impact on their attitude towards something. Knowledge and impact, they will have knowledge and perception, we have impact on their attitude, basically. So now the outcome will now be attitude towards blood donation. What's the name of the lady? I think it's Folasha did something. I can't remember who asked the question. Do you understand it? Now let's go to the question part. Amongst undergraduates of OAU students, among OAU students, not by me. How does adequate knowledge and positive perception of blood donation in comparison to inadequate knowledge and negative perception of blood donation affect the attitude towards blood donation? Somebody should clap for Esther for me. Affect or influence, you can use any one of them. The attitude towards blood donation. Somebody should clap for her. She got it. So who asked the question, please? Was it Falasha Deborah? You said, why are we taking, I don't know, because I said, why are we taking side on the kind of perception they have since we haven't done the research. We are not taking sides. Sincerely, we are not taking sides. We are still going to actually, if you check the question. Does it look like we're taking sides? Now check the question. You know, we said we can use it interchangeably, but most of the time I prefer the good one to be up, then the other one should be down. Check the question. If you check the question, Onyekosola, do we know that we are actually not taking sides? The question is like, among undergraduate students of OAU, how does adequate knowledge and positive perception compared to negative knowledge and negative perception influence attitudes towards blood donation? How does it compared? We are just comparing two things. Sure, you get it now. we are not taking sides. Do you get the income? Falashade Deborah, what did you say? Okay, it was Precious that asked. Oh, okay. Precious, do you now understand? Is she on the call? And when you take so you call you. Is she on the call?
Yes, ma. She has replied to you, ma.
Oh, okay. Do you understand perfectly, Itola? Precious? Do you understand it now? Yes, good. Thank you very much. So now I want all of us now, please write it down as an assignment. Your topic, the topic you wrote or anything, please. I need you to help me to use the framework, the PICO framework to break it down. You will write the framework, PIOCO, then you write the question, you write the topic on top, like this page, screenshot this page like this. This is my example of PICO. You write the topic, you write the PICO, then you write the question under it, please. And submit it to Mr. Badmus. Please do it. Let's break our topics down like that. We should be able to break our topics down like that. And most importantly, know that it's not everything that has comparison. There's topics that do not have comparison. So sample nursing topics. I mean, these are sample nursing knowledge and practice of pain management among nurses. Oh yeah, who should I call like this? Let me go to the chat and look for names. I want to call names. I want to call a random name. Random name. Eniola Milola. Are you there? Eniola Milola. Eniola Milola. She's not here. Those people are not in class. She's not here. So Sabankole, have you seen what I highlighted now on the screen?
Yes, ma'am. Yes, ma'am.
So you heard me to break it down into people. Thank you. Please break it down.
All right.
Thank you.
So the population is nurses, and the intervention or the exposure is adequate knowledge. The comparison is adequate and inadequate knowledge, while the outcome is the practice of pain management. So the PICO question will be, amongst nurses, how does adequate knowledge of pain management in comparison to inadequate knowledge of pain management influence the practice of pain management?
Effective pain management. Please clap for her, please. People should clap for her. Oh. Good. So now the next person, Timileyin Ikpeme, do you want to reply my question or? Sorry, I want to drop the next one. I want to drop the next one. Can we see my screen? Can we see my screen? So who is going to answer the next one? Factors affecting medication adherence among hypertensive patients. Somebody should do PICO for me. Nobody's answering me. Aisha Akwadokun, please unmute your mic and tell me.
Okay, ma'am. So the population is hypertensive patients.
Good, thank
the
you.
intervention or is factors. The comparison,
What did you say?
I don't think it has a comparison.
I didn't get you. I didn't get the intervention.
I said the interventions is the factors. Hello, ma'am.
I'm listening to you. Factors affecting medication adherence. Okay, yeah. What's your comparison?
I don't think it has. I said I don't. I don't think it has a comparison, and the outcome is medication adherence. Pico question will be, amongst hypertensive patients, what are the factors affecting medication adherence?
Amongst hypertensive patients, what are the factors affecting? I'm seeing it in a different perspective from yours, and you are actually, I cannot say you are wrong, you are right, because it could be without comparison. You get, it could. So Shakira, Ashava, please, let's try you. I'm still coming back to you. Who's the person, last person? I'm still coming back to you, please. Oh yeah, Shakira, Ashava, please, can we?
Thank you very much. For these factors affecting medication adherence, I just want to ask that, can the intervention be health education on medication adherence?
Yeah, now you are thinking like me. I am thinking about, because I'm trying to analyze it myself as I'm talking to you. So I would say, if I was the one, I would say my population is hypertensive patients. I mean, people that are diagnosed with hypertension, and then my intervention is going to be like all these facilitating factors, like maybe good knowledge, like you said, education, health education, affordable medications, and other things that can facilitate them to use it. That will be my exposure intervention. And then I would say my comparison is demiliting factors, or let's say absence of facilitating factors, maybe poor knowledge, the side effects of the drug, it is costly, and all those things. Yeah, could be the comparison. And then what is the outcome? Medication adherence. Like everyone got that. So my question will now be like, among factors affecting medication adherence among hypertensive patients. Now be like, among hypertensive patients, P, Abby, how do facilitating factors such as like good knowledge, affordable medications, compared to like barriers to care, that is my C, compared to barriers to care, influence medication adherence? Do we get it? Factors affecting medication adherence among hypertensive patients. So now we try to now list those factors. The factors can be positive. Now look at the factors as positive and negative. Do we get it? Everyone, are we following me? Let's try to look at the factors as positive and negative. We'll now say that, okay, factors affecting medication adherence among hypertensive patients. Now, my P is what? People diagnosed with hypertension. That's hypertensive patients. And then my intervention, those are, I mean, you now try to break the factors into two. The factors can be positive and negative. Hope we all know that. I would say facilitating factors, and then I would say intervention is facilitating factors. Those are factors like affordable medications, no side effects, good knowledge of the medication, family support is part of those things, and then good patient and nurse relationship. There are things that are facilitating factors. Those are facilitating factors. You know, we try to break the factors into two. So if your topic is about factors, please try to break it into two. I think that works for us. Let's see the factors, positive and negative. Then you now put one in intervention, one in comparison. For people that their topic is about factors, do we get it? Then you now say absence of facilitating factor, that is C. Like maybe expensive medication, poor knowledge of the medication, maybe very great side effects, and then maybe forgetfulness. Some people will forget. Those are it. Then what is the outcome? Medication adherence. Because we want to see those factors, what impact, what is that thing they actually working towards, what the outcome is medication adherence. Do we get it? So I will now say, oh, my question is goes thus: among hypertensive patients in OAU, we have to pick a location. You know, they are just research nursing topics. Among hypertensive patients, how do facilitating factors such as good knowledge and support compared to what do I call the other factors? What do I call it? Compared to absence of facilitating factors influence medication adherence? Please, hope I have not confused anyone. Hypertensive patients, yeah, good medication adherence, education, good. C, C, the factors affecting medication adherence and factors can ignorance, and O, good adherence to medication. Now, for Oxygen Aisha, just now when you want to write your question, you have to write it. That's why you have to write your ICO in PICO in a way that you'll be able to frame it into a question. So, among kiniko, how does kiniko affect kiniko? How does this influence? You get it? How did I additional? You missed the explanation. Because of you, let me quickly break it down. Factors affecting. Did you get the question? Please, can you on your mic? Let's have a conversation so that you'll be fast. Adedayo, additional.
Yes.
Okay, did you get the question? Factors affecting medication adherence among hypertensive patients. Did you get it?
Yes.
You got the question. Or do you want me to paste the question again? My network. See the question here. Factors affecting medication adherence among hypertensive patients. So now, if I want to analyze this now, I will bring factors can be positive or negative. So I will take the positive factors, facilitating factors as I, and the non-facilitating factors like the barrier factors as C. Then the outcome will now be medication adherence. So my population will be hypertensive patients. My I, intervention and exposure, is going to be facilitating factors like good, affordable. Can somebody give me a topic that doesn't have C? Somebody has that. Let me explain what I'm explaining to this person. So now C, I will now be facilitating factors like good support from family, affordable drugs, no too much side effects, good knowledge. Those are the facilitation. The not facilitating factor will now be things like expensive drugs, lack of knowledge, ignorance, forgetfulness. Those are those things. So those are the barrier factors. Then the outcome is our medication adherence. So my question will be like, among hypertensive patients, how do facilitating factors such as good knowledge and support compare to barriers to care? Barriers, how does it influence medication adherence? How does it influence medication adherence, which is the outcome? Do we get it? Do we get it? In comparison, good knowledge versus bad knowledge, drug is easy to use or not, etc. Okay, thank you, my boss. Nkosola, I will still come back to yours. Sorry, I am on an admin page and we're supposed to have another class soon. And Mr. Badmos knows we are having a data analysis class too soon. So I'm trying to reply my boss that messaged me. So sorry. So, Oyinkansola, I will still come back to you said a question without skinny. Let's think about questions. I asked that somebody should give us a question that doesn't have. It will come in. I will say it will come in a kidney. Okay, now let's look at it this way. Oyinka, are you here? You think this survey doesn't have a comparison? Yeshua, prevalence of survey is among. You think Yeshua, you think this survey doesn't have a comparison? Abby? Is that supposed to break it down in a way that we want to know that we are sure that it doesn't have a comparison? These people should allow me to rest here. Can't be doing 20 things together. Sorry, please. We still have about 49 minutes of program. My laptop is on 31%. Remy, can you end the generator? Show motor. Eh? So I'm waiting for Yeshua. Okay, the question can the clinic can come in so if it's coming like you are specific, or you also like it's coming like expensive medication as a factor that affects hypertensive patients, I promise you, it doesn't have a comparison. You already pick a factor, so it doesn't have a comparing factor. Do we get it? So the question would be like, um, sorry, please, I'm trying to think about it. The question that doesn't have a lot is going on in this place. My battery is low. Okay, Joshua, yes. Please, somebody should help me to tag Joshua's question. It doesn't have intervention. And the population is actually nursing students. Then the indicator, the intervention, or the exposure is now substance use, and the outcome is prevalence. Do we get it? So prevalence studies most of the time will not have a comparison. Please, somebody should give it to Yoja for me. So most prevalence studies will not have a comparison. Do we get it? Most of them. Because what? The outcome in itself is the prevalence. So that the population is undergraduate. And what we are studying is the substance use, which is the exposure or the intervention or whatever. Do we get it? Do we get it? Onyekoshala, do you understand now? Please, somebody should give it for Yeshua. Yeah, you are correct. So we've gotten a sample. So Mr. Abdulaziz, can we take the break now? And how many minutes is it going to last? Because I want to quickly on the generator and charge my laptop. I didn't charge in the morning anyway. It was on. 15 minutes, Abby. So we are coming back, let's say by what time? 12:40. By 12:40, right? Thank you very much. Thank you. So we start from the structure of a nursing project, chapter 1 in detail. Thank you.
Hello everyone. Please confirm that you can hear me. All right, so during your break, I sent a message to the call text that prevalence uses another framework called PEO. So I want you guys to share to continue the session. Thank you.